Before I go over to Manette Loudon, who will be reading this. We have more than 2,000 outstanding scientists, Nobel Prize winners, professor emerituses in virology, molecular biology, public health, who all are so outraged that they're willing to go on the record and risk their reputations. I believe that says something. They want to debate. They want to have testimony. And yet, no one has invited them to do so. So we are presenting some of their views now. But all 2,000 of their views are on my website, their credentials, their background, and their statements. For the average person who is easily misled, for the average legislator, also equally misled, understand this about AIDS in Africa. And please share this if anyone knows him with Bill Gates or Bill Clinton, because their efforts could help so much to correct what is wrong in Africa and save lives. Through their foundations and their pharmaceutical company contacts, giving expensive drugs is not the answer. Let's just use one example. Let's use South Africa, the largest country there. You have the largest identified number of people suffering from HIV infection and AIDS in Africa. You have a large African group of industrialists, multinationalists, financiers. They have no AIDS. You have, living in that same area, the mercantile groups. People own their own businesses, successful business people. No AIDS. You have a large bureaucracy, school teachers, police officers, firefighters, medics, bureaucrats. No AIDS. You have a large professional class, doctors, engineers, professors, accountants. No AIDS. And then you have a field that's about a mile wide, mile and a half. And there you have one of the largest ghettos in Africa. And there you have an epidemic of AIDS. Now just use common sense, no science. How smart would this virus be that it would skip over you if you're an industrialist, a banker, a police officer, or a professor, and infect you only if you live in this ghetto? And that is what AIDS is in Africa. Massive poverty.
Could I add something there, Gary?
Because this is the difference. Show me the people in our AIDS establishments. Show me the people making the $1 million, $100 million grant. Show me the people looking for vaccines who have gone to Africa, spent time there, lived there, researched there, as my guest, Janine Roberts, has done. Tell us your personal experience.
I went out to South Africa just over a year ago to do the research on AIDS. And I was absolutely astonished to find that the population of Africa south of the Sahara has doubled during the AIDS epidemic. That's totally contrary to everything I'd learnt. Then a doctor said to me, do you know they diagnose AIDS differently in Africa from how they do it in the United States? And I was shocked. I mean, you can't diagnose a disease differently and give it the same name. And they said, well, it's easy to discover it. Go to the World Health Organization, and they've put it on their website, how to diagnose AIDS in Africa. Well, I know Times journalists, many leading journalists, and I asked them, and they said, no, rubbish, no. They can't do it differently in Africa. Well, they do. They've got up on their website, anyone can go to the World Health Organization website and look up what's called a diagnostic definition of AIDS for Africa. It's called the Bangui definition. And it says that Africans have to score 12 points and need not be proved HIV positive. If they've got diarrhea for a month, that counts as 4 points. Impure water supplies. If consequent to having diarrhea for a month, they've got 10% weight loss, 4 points. Intermittent fever, 4 points. Dermatitis, a skin rash, 3 points. Okay, here's an African 60% of the Africans live in such poverty south of Sahara that they do not have pure water supplies. That would give them diarrhea, that would give them weight loss, that would give them dermatitis, that would give them intermittent fevers. But it's on the South African diagnostic documents given to their doctors, same documents given out in Kenya, same documents given out in Uganda. It's all set out, tick, tick, tick the boxes, score 12 points, this African has got AIDS. You then tell them, a young man, young woman, and you say, you have got a sexually transmitted, which often means lots of guilt, disease, and you're surely going to die unless you can persuade your government to purchase very expensive American drugs. Most of these drugs are making $1 billion a year for American companies. It's just inconsequential. We've got a different diagnosis for Africa. It's stupid. But then if you go to the Centers of Disease Control in Washington and look up the rules for diagnosis of AIDS, it also lists ways of diagnosing AIDS in the HIV negative. There's about 12 different ways of being found to have AIDS in the United States without being HIV positive. And at the same time, they say HIV is necessary for AIDS. I do not understand my own profession. I don't understand why my fellow journalists do not go to the World Health Organization to find out how to diagnose AIDS in Africa. It's simply presumed and logical. They think they do it the same as they do it in the United States. But you know, it was politically necessary in a way because viruses are gender neutral in who they infect men and women likewise. So if it wasn't for Africa, we'd have to say that AIDS is a male disease because AIDS is nearly totally striking down men and not women. They conceal this by giving figures and percentages, but when you get the actual statistics, I'm from the UK, last year's government figures, 47 women and 5,000 men. Also in Africa, the World Health Organization, to save money, extrapolates from the figures that they done at at the clinic. We know from the manufacturers of the HIV test that pregnancy is a risk factor for testing positive. So they take the figures from the pregnancy clinics in South Africa and they multiply them up to make a figure for the entire country. And yet, currently, the South African government lists AIDS right down below about 5 or 6 other diseases as a killer in Africa. This has outraged the AIDS lobby. They're now claiming all the people dying of TB are dying of AIDS in order to be able to say that and TB is a big killer. So they're fixing the figures. I went to the stage I stayed with other journalists in Johannesburg. I had the Times antiretroviral drugs, and we come out to give them to Africans. And I thought, well, what do I say? I don't want to start a big argument. So I simply cited a professor at Harvard who has reported that microbacteria test positive for HIV. And the reaction was, what do you say? What's that? And I said, well, the theory of AIDS demands that. And he said, you said the theory. She says the theory. And it was like I was being ridiculed for quoting a Harvard University professor.